Hi guys, welcome to my channel. So today I am going to talk about teeth removal and orthodontics. So the reason I need a double jaw surgery is because I had teeth removed when I was 18 and I had them removed as part of orthodontic treatment. It's actually a practice called camouflage orthodontics. So camouflage orthodontics means moving the teeth to compensate for an underlying jaw discrepancy, effectively hiding the skeletal issue without surgically altering the jaw itself. But this, by not fixing the jaw issue, you cause more harm, which is what happened to me. And also camouflage orthodontics is a lot quicker for orthodontists. And at the end of the day, most orthodontists are here to make money. And I am probably going to get a lot of hate comments on this, but I am happy to argue with anyone over this. I had 2 teeth, upper premolars, removed as parts to fix an overbite 11 years ago. I remember I said to the orthodontist at the time, I said, I don't really feel very comfortable having my teeth removed. Is this going to affect me? And he said, no, the only thing that might happen is your upper lip might not look as puffy. But as you can see, my upper lip looks absolutely fine. But what he didn't tell me is all the long-term health issues that I could have from having teeth removed. By having teeth removed, I developed breathing issues, my airway narrowed, I got sleep apnea, I started waking up in my sleep. So every time I went to sleep, I woke up in the morning and I just felt so tired, like all the time. And when I had the sleep study done, it was saying that I was waking up around 20 to 30 times during the night. And my boyfriend, I had to sleep in a separate room to him because he was like, you're snoring is ridiculous. Like I was waking him up and at some points he would be like, I'm genuinely like worried because he could hear me like choking myself in my sleep. And all of this happened because I had teeth removed. And that's not even going into the fact that my face completely changed as well. So I'm going to show you some pictures in a little bit so you can see just how badly having teeth removed can affect you. And don't get me wrong, sometimes teeth do need to be removed, but that should only ever be in extreme circumstances. I should have never had teeth removed because I genetically didn't have a very strong lower jaw. So when I had 2 teeth removed from the top to fix an overbite, so that pulled it back. It pulled everything back, and then over the years, everything just got worse. So by removing the teeth, I recessed, which led to there not being enough space in my mouth for my tongue. I was a mouth breather like 24/7, couldn't get enough oxygen in, and all of that could have been avoided if I didn't have teeth removed. So I'm really hoping that this video is going to educate some people, hopefully save you from having unnecessary teeth removed. I think it's something that there's just not that much out there, I think, unless someone's actually had a bad experience and they go and post about it. But orthodontists will gaslight you and they will tell you, oh no, it's fine, nothing can go wrong with having teeth removed. Teeth are fundamental. They are there for structure, they are there for function, and they are there for facial harmony. So I am now going to show you some pictures. So the first picture I'm going to show you, this is me when I was 18, so this is before I had my teeth removed. As you can see, I have quite a well-balanced, well-defined face. I'd like to caveat, I was around 10 kilos lighter, but that's not going to have an effect on the way this is shaped and the way this is looked. So as you can see, it was not a bad face. I don't know why I used to complain about my face then, but it was a pretty good face. And now the picture I'm going to show you. Yeah. So this is 2 years after I finished my orthodontic treatment where I had my teeth removed. Look at it. Like, first of all, I was 21, 22 there. I should not have had like the sagging that I do here in that picture. Like, look at it. And second of all, you can kind of see like my chin going into my neck. And then with the picture I'm going to show you now, again, like, where is my chin? Like, where is the chin? It's just blending into my neck. And actually this reminds me of a conversation I had with my boyfriend, because I said to him, for a long time, I really need a nose job. Like my nose is like really sticks out. And he was like, Kat, your problem isn't your nose. Your problem is your chin. You just have no chin. And once he pointed that out, I couldn't unsee it. And it became like a really big insecurity of mine. And I was looking at filler. I was looking at this. At that point, I didn't have the functional issues that I did have. And now I'm going to show you one more, which is, I don't even know why I'm posting this on the internet, but here it is in all its glory. This is a screenshot of a video where I fell asleep in a really long car journey. As you can see, look at the way I'm sleeping and look at my neck. Yeah, that's not normal. And I would like to say there is now this trend of people sleeping with mouth tape. Since I had my double jaw surgery, I don't sleep with my mouth open. So I'm not saying that if you sleep with your mouth open, you need double jaw surgery. But what I am saying is you might have an underlying functional issue, because naturally we do not sleep with our mouth open. So do with that information what you will. And I think for me, my jaw surgery journey was quite a long one, because it was only when I started snoring and having to sleep in a separate room that I was like, this isn't normal. Like I was 26, I think at the time, and I was like, this is not normal. Like I literally snored like worse than my dad. This is so embarrassing as a girl. And then I went through I was referred to, because I live in the UK, to an ENT on the NHS, and he was the first person that actually told me, shout out to that doctor, who told me that my issues stem from having teeth removed. Because I went there and I was like, I'm snoring, it's just like really embarrassing, and my nose is blocked all the time. And he looked at my mouth and opened, and he looked and he was like, have you had teeth removed? And I said, yeah, I had them removed when I was younger. And he said, oh, well, there's not enough space in your mouth, because that's why there's not enough space for your tongue, and it's collapsing when you sleep, and that's why you snore. And I said, oh, well, what can I do to fix this? And he said, well, I was suggesting an orthodontist. You can get like these special splints that you can sleep with that pulls your lower jaw forward. And that's kind of how it started. So I went and I saw an orthodontist about this. And again, at this point, and a few other health issues that I'd had, I started to really question people. And I said to him, is this going to cause me any long-term issues? Because it's a splint that holds your jaw in a forward position. I was thinking of joint wear. I was thinking of all these things. And he said, yeah, but it's either that or a CPAP machine. And I just thought, surely this isn't like the only thing that I can do. And then I went and I saw a different orthodontist, and he said, yep, no, let's try with orthodontics to widen and bring things forward. But unfortunately, it was not enough. So I did need double jaw surgery. I had my upper jaw moved 8.5 millimeters, and I had my lower jaw moved 11.5 millimeters. So 11.5. So not exactly small movements, but movements that have made a massive difference. So now you can obviously see what I look like now. I do look different to what I looked like. I still don't look like how I did when I was 18, but I'm nearly 30 now. So actually I'm going to be 30 in 3 months. So yeah, I'm basically 30. So it's normal to not look like how I did when I was 18, but I also don't look recessed anymore. So this is me now from the side. I do have a much better side profile. Now it's still not the strong Slavic jawline that my mum has, but it is a lot better than what it was. And the picture I'm going to show you now, so this is from my recent holiday, and as you can see, like there is a visible lower jaw again. So if you are undergoing orthodontic treatment and you've seen an orthodontist and they have said, oh no, well, we'll just remove teeth, please go and see another orthodontist. Teeth should not be removed unless medically necessary. Fixing an overbite, not medically necessary. Like, treatment will be longer, and you also have to look into the reason for your overbite, because you might have an overbite because your lower jaw didn't grow forward enough. So if your lower jaw has not grown forward enough, then you will probably need surgery, and that is the only way to fix it. You should not get teeth removed to compensate for the fact that your lower jaw is not hasn't grown enough. And I appreciate it is something that is expensive, but teeth are not something that you should save money on, because they are so essential. And I just see all these videos of people going to Turkey and getting turkey teeth, and people just don't realise the consequences of bad dental work, and it could cause you so much more harm. Teeth are not there for aesthetics. Like, teeth are there for function first and then aesthetics. So I really hope this video helps someone. And remember, just question orthodontists, question all medical people. I mean, I had a friend that was undergoing some stomach issues, and the doctor, she saw him privately as well, this was not NHS, and he said, oh yeah, why don't you chat GPT it? Bearing in mind, this is a man that charges £220 for a consultation. So, you know, you do really actually have to look for yourself out there. I'm now 4 months post my double jaw surgery. So as you can see, I do still have some slight swelling there. My face here is a lot more defined than this side, but I am hoping that goes with time. I think it takes up to 12 months for all the swelling to be completely done, but overall I am very happy with my results. I do still have a little bit of tightness there, but I've got all feeling back in my face, and I can kind of chew most things. I can't have anything that's long and thin like spaghetti. Like, that is just a no. But I can have steak and I can have chicken as long as it's quite soft, and it takes me a while to chew. But overall, touch wood, it's been worth it for me.